Welcome to the Fatty Acid Forum, sponsored by Virtus Nutrition. Join us as Tanya, PhD candidate from Cornell University, gives us a look at her research on feeding rumen-protected methionine and calcium salts with omega-3 fatty acids. Let's take a listen.
Today I'll be summarizing my findings that I presented in two posters at ADSA 2023. The title of my presentation is Feeding Rumen-Protected Methionine and Calcium Salts Enriched in Omega-3 Fatty Acids Increase plasma methionine concentrations, modify milk fatty acid profiles, and modify plasma and liver phospholipid concentrations in transition dairy cows. The transition period is a critical time for the dairy cow. Around calving, cows involuntarily reduce feed intake. However, nutrient demands increase to support fetal growth and milk synthesis. A systemic inflammatory response also occurs at parturition, which can increase the risk for developing metabolic disease such as fatty liver. Because of these challenges, nutritional strategies have been implemented with the goals of improving health and milk production for the transition cow. Methionine and omega-3 fatty acid feeding have received attention because of their known health benefits. Methionine is an essential amino acid and the first limiting amino acid for milk synthesis in cows. Methionine levels are already low in conventional feeds, and endogenous methionine status is low due to rapid ruminal degradation. Because of this, the industry utilizes rumen-protected technologies to enhance bioavailability of this amino acid to the cow. Enhanced methionine status has been shown to improve milk and milk protein synthesis, reduce oxidative stress, and enhance liver function in cows. Past recommendations for feeding methionine have been to feed rumen-protected methionine at 0.0% of ration dry matter. However, considerable progress has been made in formulating diets based on an individual amino acid requirement in lactating cattle on a basis of methionine metabolizable energy supply. Omega-3 fatty acids are fed to cattle as calcium salts to protect against biohydrogenation. EPA and DHA are two very long-chain omega-3 fatty acids found in fish oil. EPA and DHA can activate the anti-inflammatory response as they are precursors to resolvins and protectins. They can also inhibit the production of pro-inflammatory cytokines. There are, however, no established feeding rates for omega-3 fatty acids in dairy cattle. So, what is the importance of methionine, EPA, DHA in the transition cow? Well, we believe there is a potential interaction between methionine and omega-3s. Methionine donates methyl groups via the PEMT pathway to form PC, as shown in the red circles on the slide. There is evidence in non-ruminants that the PEMT pathway prefers PE enriched in very long-chain fatty acids such as EPA and DHA. PC synthesis is important because it's a critical component of very low-density lipoprotein assembly to alleviate fatty liver while partitioning lipids to the mammary gland. We suspect that this pathway is downregulated during the transition period due to the insufficient dietary supply of both methionine and omega-3 fatty acids. There is a gap in knowledge and understanding the possible benefits of co-supplementation feeding strategies of omega-3 fatty acids and methionine in transition dairy cattle. Our hypothesis was that feeding rumen-protected methionine and omega-3 fatty acids during the transition period will modify circulating amino acid concentrations, modify milk fatty acid profile, and modify plasma and liver phospholipid concentrations in transition dairy cows. To investigate this, 79 Holstein cows with 19 per treatment were enrolled in a randomized complete block study design. Cows were enrolled at -4 weeks from expected due date, and 1 of 4 dietary treatments were assigned at -3 weeks. Liver biopsies were performed at -1, +1, and +3 weeks relative to parturition. Blood and milk samples were collected twice weekly. An important component of the study was the dietary treatments and how we chose to include each nutrient. Treatments were fed in both pre- and postpartum periods. Diets were formulated to be either adequate or deficient in methionine. Adequate methionine was greater than equal to 1.13 grams of methionine per mcal of Me and supplemented with the rumen-protected methionine product smartamine. Deficient methionine diets were less than or equal to 0.96 grams of methionine per mcal of Me. We chose to feed supplemental fat at 1.5% of ration dry matter as calcium salts for all treatments. Diets enriched with omega-3 fatty acids utilize the commercial product Energy 3 from Virtus Nutrition, whereas the diets without omega-3s were supplemented with energy 2 from Virtus Nutrition. We used the mixed procedure of SAS to analyze the data, with the fixed effects of treatment, time, and the interaction between treatment and time. We also used the pre-planned contrast statements shown on the slide. Going into results, to show proof of concept, methionine intakes were greater in the diets that contained rumen-protected methionine compared to diets without, which held true in both pre- and postpartum periods. We additionally saw an increase in methionine intake with the co-supplementation compared to all other treatments, both in prepartum and postpartum. Our second proof of concept reflects omega-3 fatty acid intakes. As you can see, cows that were fed the Energy 3 product containing fish oil consumed more EPA and DHA. This is further confirmed by greater total omega-3 fatty acid intakes observed in both pre- and postpartum periods when cows were fed EPA and DHA. Specifically looking at plasma methionine concentrations, you can see that during week 1 and 3 of lactation, plasma methionine concentrations were greater in diets containing rumen-protected methionine compared to diets without rumen-protected methionine. Milk, EPA, and DHA content and yields were driven mainly due to the diets that contained omega-3 fatty acids. We also observed greater milk de novo fatty acid content and yields with the co-supplementation, indicative of an additive effect occurring. Next, we first wanted to confirm the idea that as liver triglyceride percent increases, hepatic phospholipids enriched in PUFA would decrease, which you can see here when looking at correlation coefficients between liver triglyceride percentages and various liver phospholipids. For the remaining results, we can speculate that phospholipids containing 5 double bonds likely are coming from EPA, and those with 6 double bonds are likely coming from DHA. First, looking at liver phospholipids, we found greater liver LPC EPA and LPC DHA in omega-3 fatty acid diets, which was expected. We also observed lower liver PCPE 38:6 ratio with the co-supplementation treatment. This was surprising because this suggests more substrate, or PE, and less product, PC, for the PEMT pathway. So methionine supply may be insufficient to support an increase in PEMT substrate. This is further supported by a greater total PE level in the omega-3 fatty acid diets, whereas total PC levels were unaffected by treatment. Looking at plasma phospholipid concentrations, they followed a similar pattern to that of the hepatic phospholipid concentrations. What I'd like to point out is that we observed the greatest plasma LPC DHA concentrations in the co-supplementation diets, which is indicative of an additive effect. To summarize our findings, we provided proof of concept that feeding methionine resulted in greater methionine intakes and greater plasma methionine concentrations, and with omega-3 fatty acid feeding resulted in greater omega-3 fatty acid intakes. We found that feeding omega-3 fatty acids increased milk EPA and DHA content and yields. We also observed greater milk de novo fatty acid synthesis due to the co-supplementation feeding strategy. And lastly, we found feeding omega-3 fatty acids increased plasma and liver PC, LPC, and PE profiles. Diets adequate in methionine alone did not alter plasma and liver phospholipids. And we believe that there is an additive effect occurring with selective phospholipids. However, further research is warranted. I'd like to acknowledge and thank the Foundation for Food and Agriculture Research, Adiseo and Virtus Nutrition for funding this research. Thank you for listening. Feel free to email me if you have any questions.